Hello, everyone. My name's Andy Biggs. I'm Congressman from Arizona's 5th Congressional District. I'm joined today by a great leader of a group called American Commitment and the Committee to Unleash American Prosperity. He's on Twitter a lot. His information is you have to get it if you want to know what's going on with the COVID virus. He's been all over that. And Phil, thanks. Did I say your name? Phil Kerpen. I just may make sure I said that. I might not have said the name. So Phil Kerpen's with me today. Phil, thanks for joining me.
My pleasure.
So what would you tell parents or teachers? Actually, in my district, parents and teachers want to open schools. It's the school boards that don't. But what would you tell people who are concerned maybe about opening schools?
I think that school closures are far more dangerous than school openings. And that's not hyperbole. That's pretty clearly true in the facts and the numbers. And if you look at what the CDC has said, we are now seeing among the school-age population more suicides and drug overdoses, just the increase, the excess over what we normally expect, than we've seen total COVID deaths among the school-age population. That's how rare COVID is, and the hospitalizations in the school-age population are also significantly lower for COVID than they are for influenza. And so we're really suffering, I think, a crisis from these prolonged school closures, a mental health crisis, which is causing those suicides and drug overdoses, but also an education crisis because the loss of classroom activity the loss of classroom instruction is a significant harm in terms of, children are falling very far behind. We've got this sort of the COVID slide, which is considerably worse than a normal summer slide. We've got kids in many places that haven't been in school since March. The so-called virtual or distance instruction has been a woeful substitute for the vast majority of students. And we've got a lot of kids who are dropping out entirely, who are not logging on to the virtual thing and may never be back in school if they're people who are in high school. And, I've seen some school districts where as many as a third of students didn't log on a single time. And that has enormous health consequences as well. When you talk about educational outcomes, those really matter for long-term health because there's a 5-year difference in life expectancy between a high school graduate and a high school dropout. Not only do you make more money, you live longer, you have better health. When you have higher educational attainment as well. That's a pretty long understood relationship. And so when we fail our children educationally, we fail them in terms of health as well. And there are other health consequences of closures. A lot of kids rely on school for nutrition, for other services and so forth. But the big thing is not getting educated. And that has an enormous health consequence, as I said. So the closures are very dangerous in my judgment. Would openings be dangerous as well because of the disease? And the answer, fortunately, is no. This is a disease that overwhelmingly spares the young, far more so even than influenza and other things that we're accustomed to. The risk of dying with COVID, pediatric, is minimal. It's not zero because we've had some, but it's minimal. We've had less than 100 pediatric deaths total. And if you look at it in context, the head of the CDC has said that flu is 4 to 5 times more dangerous for school-age children because about half of the pediatric COVID deaths we've seen are below school age. So you have to sort of take those out of the question about school. And then you kind of look at it in context. Flu is 4 to 5 times more likely to kill a child than COVID is. And it's also about 3 or 4 times more likely to hospitalize. And flu is not very likely to kill a child. I'm not saying go be scared of flu. I'm just saying that to put it in context, the risk is very, very small. And then there's this question as well, okay, so children are not at risk themselves of health harms, but will they pass it on to others? Will they spike community infection from schools being open? And we have a lot of really good evidence that they will not. Children are able to be infected, even though they usually it's very mild or completely asymptomatic. They are able to infect others, but it's very rare. We just got, for instance, a brand new study out of Spain that found that the R number, the infectivity rate among children, is about 0.3, which is about, if you compare it to being 2 or 3 for adults, it's, 6 to 10 times lower for children than it is for adults. So an adult can infect someone, but not very efficiently. It's very rare. And the United Kingdom has found that they've not been able to find, I guess I should say, a single confirmed case in the entire world of a teacher who was infected by a student. And that's not to say it will never happen ever. It may have already happened somewhere and it just hasn't been confirmed yet. But you can be pretty confident that that's an exceedingly rare event if we don't have a single confirmed instance of it yet. And so I think that we need to put these things in perspective, understand that it's very unlikely that you're going to see a significant increase in transmission of children. The CDC never called for schools to be closed. They never said they were a high-risk setting. The school closures were a panic, and it just became contagious and spread over the whole country, but it really was never well justified on the dynamics of the disease, and they've caused enormous harm, in my judgment, for essentially no public health benefit. And so,
Yeah, and Phil, we've seen all over the place the teachers and teachers led by teachers unions putting up obituaries and tombstones, trying
right.
to indicate this, and it certainly seems hyperbolic at the bare
Very
minimum.
strange. Look, teaching children is not a high-risk profession because children are so much less likely to be infected and to be infectious than adults. And so we've got actually occupational studies. There was a very good one from Sweden, which had pretty much an open country throughout the whole thing. They closed high schools and colleges for a little while, but primary schools and daycares were open throughout the whole thing, and most of their businesses were open, including bars and restaurants and so forth. And so that should be kind of the best source of data on different occupational exposures. And they found that the occupational risk for teachers was no higher than average across occupations. The really high risk occupation, the number one was taxi drivers. And I haven't seen them striking and going crazy and saying that we want them to die. But they had an actual exposure risk related, occupational exposure risk. So there's very little evidence that teaching is a high risk profession because children are so seldom infectious. And by the way, when children do infect others, they usually infect other children, not adults. We have very few instances even of children infecting their own parents. It's almost always parents infecting the children. And so I don't want to say it can't happen. We may have an instance of it, but as I said, the fact that there's not one confirmed case in the world of a teacher being infected by a student means it's going to be a very rare event. I do think we may get some school outbreaks and some school-based transmission, but it's more likely to be among the staff or among the parents. It's the adult interactions that you have to be careful about and take precautions. But the adult interactions are so few that you can deal with that. You can be careful at drop-off and pick up that kind of thing, maybe close the faculty lounge. And so I think that there are sensible modification to school operations, but the idea that we're going to punish children indefinitely and deprive them of an education, deprive them of interaction with their friends and with peers because of something that presents no risk to them, just because we think it might have some effect on transmission. I think that would be morally wrong, even if they were big transmitters. It would be wrong to punish them instead of protecting the people who are actually at risk. But the fact that they seem to be such inefficient transmitters means that these complaints from teachers, I think, are primarily political. I mean, I think you've got a lot of teachers unions that think that they can paralyze the country by preventing kids from going back to school and therefore prevent parents from being able to go back to work and kind of keep the country and the economy paralyzed through the election. Now, that's kind of a cynical outlook, I guess, but it's hard to explain the vitriol and the extent to which so many of these unions are opposing going back no matter what precautions are taken, other than to say that their motivation is insincere and maybe political.
Yeah, and they don't want to talk about the science and the data ever. It is, as you say, it's visceral, it's emotional, and it's a kind of a hysteria that's kind of spread. And we talk K-12, universities. Some of them are trying to open up, but their population is also their student population is they test positive a lot, but they don't test positive with serious results a lot.
Right.
So
you have extremely low hospitalization and death rates among that age group, and in fact, we're almost certainly going to lose more people to suicide and drug overdose in the college age group than we are to COVID. If you look at the recent statistics that came out of the CDC, they found that 25% of young adults age 18 to 24 seriously considered suicide in the last 30 days. That number before COVID and the lockdowns, that number was about 11%. So we already had kind of a crisis in terms of mental health in that age demographic, but it's more than doubled as a consequence of kind of the deprivation related to lockdowns and closures of universities and related activities and sports and everything else for our young adults. And they're at very close to zero risk statistically if they get this virus, very close to zero, similar to children, a little higher than children, but still very, very close to zero. And so, the issue there, I think, is, how do you have colleges operate, have younger adults be able to engage in activities while understanding that if you are around someone who's older, you need to be careful. You need to take the precautions with people who are truly vulnerable. Don't go visit a nursing home, although most of them are still closed to visitors. But they say we need to stop giving advice for the entire society as if everyone is equally at risk. Because if you do that, you're gonna have a lot more people die than if you say we're going to target the protections and the distancing and the protective equipment and so on for the people who are truly at risk. And I think we've really failed to do that. And that's a real failure for our young adults in the same way that it is, for our children.
I agree with you 100% on that, Phil. I think that the strategy to apply this to somebody who's over 80 with several comorbidities, same strategy that you're applying to a 6 or 7 year old child is just is not well thought out. So
it'll actually lead to more deaths too,
yeah,
Congressman, because this is going to infect whatever percentage of the population. It looks like it's around 20 or 25 in most places, that you get enough sort of community immunity for it to level off and fall. We want as few truly vulnerable people in that percentage as possible. And so when you have people who are very young and very healthy, from a community-wide perspective, as long as they don't pass it to someone who's vulnerable, you're better off as a community for them having had it, because you're closer to getting to that immunity break point. And so I think we have sometimes this destructive belief that you can stop the virus completely, and that's not going to happen. And so we need to think, I think, a lot more about who really needs to be protected. And we haven't done a good job of that.
No, you're right on the. I'm with you 100% on that, Phil. And I appreciate your perspectives on it. And just, ladies and gentlemen who are listening, just so you need to know, neither Phil nor I just are talking off the top of our head. I know Phil pores over data and studies and research, even far more than I do, and I look at it pretty regularly and as much as I have time to look at, because it's out there, it's available. And so when we talk about this, we talk about Centers for Disease Control. They really have three points that I want you to cover real quick, Phil, is they now changed their policy and said asymptomatic people should not be required to take a test anymore. They also said that, and that really isn't much of a change. The CDC guideline with regard to mask has been pretty consistent, but it's been, in my opinion, misinterpreted, and that is prolonged exposure. Wearing a mask during prolonged exposure to coronavirus will not prevent possible infection. And the third thing is, if you're coming from another state or overseas, they say you shouldn't have a 14-day quarantine anymore. So, Phil, can you cover those three real quickly for us?
Yeah, I think the testing recommendation is really important. It's being distorted in the media a lot. They're not saying you can't get a test unless you're symptomatic. What they're saying is we don't automatically recommend or require that people get tested unless they have symptoms. And I think that's a really important distinction for people to understand. Anyone who wants to get a test in this country can. They're very widely available now. But the point that the CDC was making with that revision, which I agree with and I think is an important one, is if you're healthy, if you're not feeling sick, you're not required to take a test. Because if we require massive numbers of healthy people to take tests, all it does is feed the numbers of sort of trivial positives, where someone might have old dead debris virus in them that's no longer active but triggers a positive. True, false positives, which are just an artifact of testing. And the idea and sort of the media hype and fear cycle also of finding a bunch of people who are positive but are not sick. That's not necessarily helpful information. Now, if you're worried that you're not sure, you feel a little off, or you were close to someone, you don't want to risk infecting someone else, because asymptomatic transmission does exist. It's much less efficient than symptomatic transmission, though. It's not a major driver of the epidemic. We have a lot of pretty good evidence now that shows that the case. That said, it can happen. So if you want to be totally sure you had an exposure, you want to know you're not going to infect you can go get a test if you want to, but we're not going to require that of everyone, or require that of everyone who was ever in a room or had a brief passing encounter with someone who later tests positive. And I think that's a really good thing. I think testing should be used for diagnostic purposes much more than surveillance purposes, which is to say, if you're sick, a test will help you figure out why you're sick and what the best course of treatment is, as opposed to we're just going to try to test everyone to have these numbers and keep the fear going. And so I thought that was a sensible change. Remind me your other two questions. I'm sorry.
The mask that
Yeah.
they acknowledge now very clearly that wearing a mask when you have a prolonged exposure to coronavirus doesn't prevent possible
Right.
infection. And the way they define prolonged exposure is within 6 feet for more than 15 minutes.
Yeah, that's always been the definition that they've used for exposure, because the best evidence we have shows that sort of a fleeting encounter is very unlikely to pass the virus. Not impossible, but very unlikely. It's those prolonged close contact exposures, especially in indoor settings that have poor ventilation. That's where you tend to see most of the transmission. And I think the note that the CDC has on that page is really, really interesting, because I think that a lot of people are attributing more power to masks than they really have. And that's why a lot of the public health experts recommend against masks, including in sort of all of the Nordic countries. And if you look at their statements, what they say is, look, it gives people a false sense of security if they think, hey, I have a mask on, so now I can sit right next to somebody, even if they're coughing, and it's going to be fine, and I can sit in, and the mask is going to protect me. If you have an exposure event and you're near someone who's got droplets or aerosols coming out of their mouth that have virus in it, the mask is pretty unlikely to stop it. It might stop it a little if you look at sort of the filtration properties for the different mask materials. The best are like this, other than the medical grade masks, which they're telling us not to use. The disposable surgical masks stop something like 40% of respiratory droplets, which is, it's at 40% is a lot more than nothing. It might be pretty good, but if you have that prolonged exposure, there's still a good chance it's going to somehow get in, and you're still at risk. And the fabric ones stop very little. I mean, depends on the type of fabric, but it's, they're like 5, 10, 12% if you look at the World Health Organization. And so it's pretty unlikely to make the difference. Might it? Yeah, it might on the margin make a little bit of difference. And so, if you want to use it for that reason, or if you're required to under a local law, that might make sense. But be aware, it's not a substitute for distance. And if you were near someone and you're starting to feel a little off or what have you, you might want to get tested. Don't assume that just because you had a mask on, that's going to somehow make a big difference. It's unlikely to make very much difference at all. And the other challenge, Congressman, with the masks is, it's very hard for a normal person to handle it correctly. Surgeons are trained for years and years and years to never touch anything except their surgical field, and take it off very carefully and touch it. Anytime you touch it, wash your hands, get a new, replace the mask every few hours. There are all these sort of handling instructions that almost nobody can actually follow. And so if you're touching the thing all the time, you're taking it off and putting it on, you might be, if there is virus on it that it stopped from an encounter, you might be touching it and getting it on yourself some other way anyway. And so I think the benefits are pretty small for most people, and you need to be very, very careful with how you handle them to be able to take them.
So Phil, my own experiences having been exposed, and by protocols in the house, I needed to call and say, look, it looks like I might have been exposed. And the only thing they cared about was distance. I said, well, the individual was covered with a mask the whole time. I was outside of 6 feet by a long shot, but I said, but he had his mask on the whole time. And they said, oh, we don't care about the mask.
Right.
The mask is basically fundamentally irrelevant. We just want to know how close you were for how long.
Yeah, it's interesting because, the countries that are advising against masks make kind of this point. They say, look, if people think that the mask has more power than it does, and then they end up being closer together because they've got the mask on, then it could actually be counterproductive. And so, I think it's more about kind of like, I think the reason, my theory on why the masks became so popular and why the mandates became so popular is I think that, and maybe this was based on polling, I don't know, because a lot of Republicans all came out for it around the same time. So I might not know all the reasons behind, the motivation behind it, but I think the idea was, look, people in their homes, they're scared. We've got to get society moving again. We've got to get the economy moving again. This will give them reassurance. This will give them comfort that they've got some protection, that they're not going out with nothing. And that's not really a good reason to adopt a public policy if the protection is not really very effective. And so I do worry that it's more of a false security than it is a real protection. All of that said, the virus is now at very low levels in most of the country, with the southern wave kind of crashing, and with the decline in your state's been as sharp as it was in New York and New Jersey. But interestingly, they got huge coverage on the run up and the run down. You only got coverage on the run up. You start crashing and they stop talking about it. They didn't want to talk about it. Did you notice that?
I did. I did notice that. And hey, we're almost out of time, Phil. So I want to get to this last question that I had down that I think is important. Is well, and I asked this. Let me give you just slight context. I'm already hearing people on the other side of the aisle talking about, as COVID's waning down, it's going to intersect with the annual flu epidemic, and we're going to probably have to take some severe action there. Where do we go from here? What do you think the best exit strategy is for here?
Well, look, I think that I think we need to get as close to normal as we can as quickly as possible. And I think that the evidence is now pretty clear that the more heavy-handed government interventions have had very little, if any, incremental benefit, may have actually been counterproductive. You look at, you look at the southern wave, and as much as I'm sure you and your constituents were going crazy about the restrictions that the governor put in, they were so minimal compared to what those northeastern states did. And yet you had essentially the same rise and fall, almost like it made no difference. And, you look at as a country like the United Kingdom, and I can think it's hard to avoid the conclusion that for the most part, the virus does what the virus is going to do. And the main impact of the heavy-handed policy intervention is just the additional deprivation and harm and suffering that's caused by that on top of what the virus does. And so I'm all for smart distancing and things that you can do consistent with living in your daily life. But the heavy-handed government interventions, I think, have been uniformly counterproductive. And look, we don't know what this flu season is going to have. Let's all hope and pray that they've got the right strains in the vaccine this year and it's effective and we don't have a bad flu season, because if we do have a bad flu season, while everyone's obsessing about every fever and doing temperature checks everywhere, and everything is going to be, every time somebody gets 100-degree fever is going to be a big catastrophe. It's going to be challenging just from the normal things that happen, the normal diseases that circulate and so forth. And so I think that we've got to have, a better sense of perspective. People do get sick. They're viruses that circulate. It's always been that way. This particular one was a nasty, nasty virus, especially for older people who were very vulnerable to it. But let's not react in haste and in panic and do things that it turns out have costs that far, far exceed the benefits, if there even are benefits. And so I was really disturbed that Hawaii went back into lockdown this week, because to me it means that their governor did not learn the lessons, and that's really unfortunate. And I hope that won't happen in any other states, even if they do have a bad flu season.
Hey, so Phil, give us your Twitter handle and how people can follow you.
The Twitter handle is my last name, Kerpen, Kerpen, and I'll also mention that with Committee to Unleash Prosperity, one of the groups I work with, I do a daily newsletter. It covers some other issues, but it's mostly about coronavirus. And I do it with John Fund and Steve Moore, and it goes out every morning, and it's free. And I think it's pretty good. If people want to get that, committeetounleashprosperity.com is where you can sign up for that.
Hey, Phil, thanks for your good work on coronavirus and all that you've done to educate Americans. And thanks for taking time with us today. And Godspeed and best of luck to you and yours.